Every day, critical care nurses prepare for the worst, but hope for the best. For any given patient, responsibility is shifted multiple times, from nurse to nurse, shift to shift. Proper delivery of care for each patient can become a challenge. Don't let this be an excuse. Sepsis is ranked among the top 10 leading causes of death according to the National Vital Statistics Report. Sepsis-related hospitalizations more than doubled in 2008 when compared to reports 8 years prior. The incidence of severe sepsis is expected to double over the next 25 to 30 years. And mortality from sepsis is greater than that of breast cancer, lung cancer, and colon cancer combined, and is the #1 cause of death in the non-coronary ICU. We have to ask ourselves, is there more we as nurses can do to prevent sepsis-related deaths in the hospital? Through the use of a standardized sepsis guideline, nurses may have the potential to improve early recognition of sepsis, ultimately improving patient outcomes and saving lives. What if I told you there was a way to help? The Surviving Sepsis campaign outlines 17 guidelines recommended for early detection and treatment of sepsis-related illnesses. A 2009 study by Dirthaler and Johnson surveyed hospitals across the U.S., all varying in size, regarding to their adherence to the 17 suggested guidelines. Most hospitals reported only following a few, if any, of the guidelines. Also, the AACN provides a practice alert for initial recognition and resuscitation of severe sepsis, reporting a 30 to 60% mortality rate. Clearly outlined are the expected practices, supporting evidence, and actions for nursing practice. We would start by formatting a screening tool. The nurses would use this on admission, the beginning of each shift, and when symptoms changed. An algorithm would indicate when to contact the physician and which nursing treatment was necessary. This would decrease any doubt a nurse may have, as well as provide standard of care for those exhibiting possible sepsis. This type of protocol would increase laboratory and equipment costs. In addition, designated staff would be necessary to formulate, implement, and carry out the protocol. The sepsis screening tool would entail teaching to all nursing and medical staff. Many of the studies used to emphasize the importance of educating all staff before, during, and after the implementation process. All of the studies shared one important point: a decrease in hospital stays and a decrease in the number of sepsis cases. Despite the increased cost to implement such a protocol, the cost of healthcare for septic patients, especially those requiring extended critical care treatment, would be drastically decreased. With the support of many reputable sources, sepsis proves to be a problem within our hospitals. We as nurses are in a powerful position to help lower the incidence of sepsis and sepsis-related mortality. We can save lives.